Hello, everyone, and welcome to this audio podcast. This audio podcast is part of the series, the Cortex Narrate series. This audio podcast is part of a Cyclone Cascade. This audio podcast is part of a Coachella Blitz, and this audio podcast is part of a Storm Robotics production. In this audio podcast, a little bit around some around the introduction or intro to some collaborative works, and some works that had been original from 2016, uh, and so looking at chronic kidney disease, or CKD, as a long-term condition or long-standing condition in which reduced renal function is evident and or damaged, and where the kidneys are unable to filter blood to achieve normal physiology. At the same time, with an aging population, CKD has been evidenced as a major sort of public health concern, and in the United Kingdom, it has a higher risk of death than other primary health conditions. Owing to increase in prevalence of primary diseases as well at the same time, and there is a higher risk of developing CKD, and there are also other factors that have an impact on disease elements, including including um, including including um, including aspects around epidemiology, demographics, and and aspects in around determinants, different aspects around determinants of health. So the aim of this works originally was to understand some of the terminology and contention surrounding CKD classification and identification, and the rationale for having a sixth CKD stage is explored as an alternative to CKD stages 3A and 3B. In addition, some emphasis on the National Institute for Health and Care excellence on NICE guidelines are also highlighted. Are also highlighted. Therefore, this audio podcast delves into the series looking at again issues in CKD, or chronic kidney disease terminology. That draws this audio podcast to a close, and this audio podcast is part of the Cortex Narrate series. This audio podcast is part of a Cyclone Cascade. This audio podcast as part of a Coachella Blitz, and this audio podcast as part of a Storm Robotics production.